Malnutrition. Malnutrition can be categorized according to the duration and severity. When it is classified according to the duration, it can be divided into acute and chronic. In acute, the parameter that is affected is weight for height, and in chronic, the parameter that is affected is height for age. When classified according to the severity, it can be moderate and severe. Severe malnutrition is when the Z-score is less than -3 standard deviation, and moderate is when the Z-score is between -2 to -3 standard deviation. We define a child as SAM when any of the three following features are present. Number 1, if the child has bipedal edema and other causes are excluded, like liver problems, heart problem. Then, or if the mid upper arm circumference is less than 11.5 centimeter, or if the weight for height Z score is less than -3 standard deviation, then we say, if any of the three is present, then we say that this child is of SAM. Now, what are the complications of SAM? We can see hypoglycemia, hypothermia, infections, electrolyte imbalance, dehydration, and some deficiencies in a child with SAM. Now, treating hypothermia. We say hypothermia when either axillary temperature is less than 35 degree Celsius or rectal temperature is less than 35.5 degrees Celsius. Then we try to rewarm the patient, start warming, and we try to achieve body temperature that is rectal temperature that is above 36.5 degrees Celsius. Hypoglycemia is said when the child has blood sugar level less than 54 milligram per deciliter. We see that the child is whether symptomatic or asymptomatic. Symptomatic in the sense that is it convulsing or having any palpitations, sweating, etc. When the child is asymptomatic, we can give him oral feeds, like oral feeds of dextrose. 50 ml of dextrose can be given orally, or if it is not accepting orally, we can give it by nasogastric tube. Then, if the child is symptomatic, we give IV fluid, 5 ml of 10% dextrose, 5 ml per kg of 10% dextrose. In neonate, we used to, if a neonate had hypoglycemia, we were giving 2 ml per kg of 10% dextrose. Here we are giving 5 ml per kg of 10% dextrose. Then infections. If a child has hypoglycemia, then we are suspecting that he may have infection also, because of infection, because of a high bacterial count, it can lead to hypoglycemia. So if a patient has hypoglycemia, we also check for infections. And in hypoglycemia, if the patient has hypoglycemia, we after giving him dextrose, we start feeding him every 2 hourly, and checking for infection if there is, or we start antibiotics. Okay, so in antibiotics we can give orally amoxicillin or ciprof or cotrimoxazole. If the child has signs of infection, then we can give IV ampicillin plus gentamicin from day 1 to day 2, followed by, for 5 days, we can give amoxicillin. So basically, if a patient of SAM comes, we give empirically antibiotics, oral antibiotics on day 1, which is either amoxicillin or cotrimoxazole. But if the patient shows the sign of infection, then we give IV antibiotics like ampicillin plus gentamicin on day 1 to day 2. Then we follow it by 5-day course of amoxicillin. If the patient has septic shock, we give third generation cephalosporin. If the patient has meningitis, we give third generation cephalosporin. And if the patient also have skin infection, then we add cloxicillin.